So, everything's going well, really well. You're getting bigger and bigger. And it's not long now until that day, until the baby arrives, until the baby has to squeeze her way out through your pelvis and into this world. But I imagine there could be a few worries about how is that baby going to squeeze itself out of the pelvis. So that's what I want to talk to you about today. First of all, we're going to talk about the baby. This is baby Harriet. She has got an amazing head. This head, the skull bones aren't joined together yet. See the lines? They're called suture lines, and she's got an anterior fontanelle and a posterior fontanelle, two big soft spots. So when it comes time for Harriet to squeeze through her mum's pelvis, these bones are going to ride over each other and squash up so that her head can get smaller and fit through easier. Now there's another magic thing that happens when you're having a baby to make it easier for the baby to squeeze through. This is the pelvis. Now the pelvis has got at the front a symphysis pubis joint, and that's joined by ligaments, and at the back a sacroiliac joint, and that's joined by ligaments as well. Now when a woman's pregnant, she gets this hormone called relaxin circulating around her body, and it softens all of these ligaments. So when baby Harriet and her movable head come to squash through the pelvis is actually able to open up more by these ligaments stretching, so that this cavity that baby Harriet's going to come through gets wider and makes it easier for baby Harriet to come through. So what I want to do is show you how baby Harriet is born through the pelvis. Okay, so here's Harriet tucked away nice and snug and warm in mum's uterus, mum's belly getting bigger and bigger, Harriet getting ready to come out. Now, I want you to know that there's a difference between a vagina and a cervix. This white part here is the vagina. Now, when a midwife or a doctor talks about a dilatation and all those numbers, she's 5 centimetres dilated, she's 8 centimetres dilated, they're talking about the cervix, not the vagina. So the baby is going to come through the vagina, but it's when a doctor or a midwife reaches up into the vagina, they can feel the cervix, the tip of the cervix, and that's what we want to dilate and to open up to allow the baby to be born. So for the demonstration, I'm going to take off Harriet's mum's vagina, put it off to the side there, and let's have a look at Harriet's mum's cervix. So this is what we'd call a nice long thick cervix, and as Harriet's mum has contractions, this cervix is going to get shorter and shorter and drawn up into the uterus and open up. See how it opens up like that? And open up until it gets to 10 centimetres dilated, and when it's 10 centimetres dilated, that's when Harriet's mum is going to start to feel like she wants to push, and the baby is going to start to come down and out. Okay, so that's what happens to the cervix. It goes from long and thick to fully dilated at 10 centimetres. Now let's have a look at Harriet coming through the pelvis. I've just got to put it there for a second. Okay, so we're just taking the uterus back for the purpose of the demonstration. Now here is Harriet. Most babies are going to come this way. They're going to be left occipito-anterior, which means the back of the head is facing to the left at the front. And she's going to come down into the pelvis and descend. And as she hits the pelvic floor there, her head is going to rotate, sorry Harriet, to the front. And her shoulders are coming in sideways. So her head, whoops, it's a bit squashy for Harriet getting into her mum, but there we go. Harriet's in. Okay, so the head's in and the shoulders are sideways. Now as her mum pushes with the contraction, her shoulders descend into the pelvis and her head is born. Okay, now you can see, or I hope you can see on the movie, that the shoulders are in and the head's not lined up. So when that head's born, it actually rotates around to line up with the shoulders so that everything's back in line again. At this stage, the midwife or the doctor is going to pop their fingers in, have a feel for the cord to make sure that the cord's not around the baby's neck. Now if the cord is around the baby's neck, they're going to stretch it up, whoops, and it won't come off like that because it'll stay attached, up around the baby's neck and loose so that it's not around there. If it's too tight, they'll cut it and clamp it and use a clamp similar to that or a metal clamp. So now that Harriet's cord isn't around her neck, with the next contraction, the anterior, the front shoulder is going to be born. If it's a little bit tight, a midwife or a doctor might put a little bit of downward pressure, but hopefully mum's going to do it herself, and that front shoulder is going to come down. Now, if you're in hospital where they give a drug in the leg to help the uterus contract afterwards and birth the placenta, they'll give that right now, a jab in the leg when that anterior shoulder comes. If they're not, then you won't be having anything. You won't. So if you feel a little jab in hospital, that's what you'll feel. Then the posterior, the back shoulder comes through, and Harriet is going to follow, without her uterus, leave that behind, she's going to follow the curve of the tailbone. So if mum was on her back, she would be following the curve, coming round and up onto mum's belly. If mum was on the floor, she'd be following on all fours, she'd be following the curve, coming round and onto the floor underneath mum. So there we have Harriet born. I'll just pop her over here whilst we have a look at the placenta. Now, if you've had the needle, the uterus is going to contract and tighten, there'll be a bright show of blood and the cord will lengthen, and then the midwife or doctor is going to deliver the placenta by what's called controlled cord traction. So there'll be, I'll put their hand up here on the uterus, and then there'll be a nice downward traction that will deliver the placenta and the cord. If that hasn't happened, then there could be a 20-minute wait, and they'll wait for the cord and the placenta to start to deliver itself, and the mum will actually deliver it with a push. So we're going to assume with this one that the ladies had the needle just because there's nobody to push it out. I need to pull it out because Harriet's mum isn't really here, it's just me. So we're pulling out nice and gently. It'll be really slow, and when the placenta can actually be seen, the midwife's going to bring her hand up here and then twist really gently so that all the placenta comes out and all the membrane comes out, because we don't want to leave any of it behind. And once it's born, put over into the tray, and mum will have bub up on her chest and be having her first breastfeed. So remember, pregnancy and birth is about how you feel on the inside. Listen to what everybody's got to say, but most of all, listen to your heart. I hope your birth's beautiful.